Using our ruler tool, we can go from the upper incisal edge to about where the enamel dentin junction would be, so where the tooth starts to waste in towards the root. Again, we're just going to do some estimating here. I know you can't see everything perfectly on here, but you're going to measure something like this. And with the measurement log turned on, which will appear down at the bottom of your window, you can say record measurement, and it's going to give you a length of 0.75 centimeters, so it's slightly less than a centimeter. And then you have to run this through that regression calculation, and that will give you the lower lip thickness. And that will be, if I just go to my measurements front here, if I want to paint in here, I can select that layer, select my paintbrush, and let's say that gave me a measure of whatever. I can pull down some guides from the meeting point here and find that measurement along the rulers here. So if it's it's a centimeter and a bit, then that can be my guide, and I can draw in where the lower edge of the lip would be. Now when we're actually drawing the lips, all I can really suggest is to look at references. But generally speaking, the lower lip, and I'll post a video about drawing the lips too that you can watch, but the lower lip is really made up of two pieces, two lateral sort of bulbous areas here, and they're going to move over to the corner of the mouth. So it's going to be thicker in the middle and just sort of tend away to the corner there. That's all you really need to draw for something like this. It's giving you some guidance about the thickness of the lips here. We do the same measure for the upper central incisor. We don't have much of it. Try and make a measurement for what you think where the enamel could end. Again, this is like a real world example. And run that through the regression, and you might get a measure something like this, and then you can draw the upper lip. The upper lip is different than the lower lip. Look at your neighbor's lips if you want to. But there's a central nodule and then two lateral components. Generally speaking, there's no real information here to give us any idea about the shape of the lips. So we can just draw sort of generally the rough kind of lip shape that we would sort of expect. There's going to be a central nodule. It's going to go to the corner, and then at the philtrum there'll be some sort of dip here. So this is no artistic masterpiece. In fact, this is almost like a childish drawing of lips, but this is all we can really know about the structure here. We've got a good idea of the width, we've got a fairly good idea of the thickness, and kind of a good idea of where the meeting angle is. And so we can establish something that gives us something to work with when we get into Maya. So what I would suggest you do while you're doing this is look at images of people's lips, especially if you can find people from the same population. This is probably Southeast Asian, Sri Lankan, or something like that, so you can look at examples that might match that. But you don't need much more than something like this. So this is drawing it from the front. And you can see I'm just doing it in this front measurements area here, because we're going to trace over it later on in the drawing, but this is just giving us some roughs that we can work in. You can draw stuff in like the upper and lower measurements here, position of the corner of the mouth, and so on. But then eventually we have to do it in the side too. So if I turn on the side view of the skull, and it's probably best to take this side view and with our arrow tool just to move this over so we can draw the middle of the face somewhere like this. I think that's the best thing to do. Or if we actually, it might be better to draw it centrally, just over a little bit. But we can use these guidelines from our assessment in the front view to figure out what the mouth would look like in the side view. So you're going to have some tissue depth markers here that give you some idea of the tissue thickness in these areas. So you'll be able to draw the soft tissue like this, but you know that the meeting angle of the lips is right here because you've established that over here. The corner is going to be, now there's no real great way to measure this here in the side view, but you know that if you find the lateral edge of the canine, it's going to be something like this. We know the lower thickness, so you can start drawing in the shape of the face to follow to the tissue depth markers that you have here. Oops. So you're using these same guides to find the thickness of the lips that you've established in the front. Okay. Same thing as I said before with the eye. You've established some of these things over here, so you can take guides from the drawing of the eye to establish what the eye looks like in the side view. And you can turn these on and off. If the skull is too bright, it's taking up too much of your visual space, you can select that layer and turn down the opacity so it's a little fainter. One thing I'll warn you of is make sure you know what layer you're drawing on. So you can see I had the skull selected and I started drawing on there. I want to make sure you're always drawing on the layer you're intended to be drawing on. So we've got our measurements here. Just going to use those. So let's go back up here to this stuff. So the mouth, we can establish a lot about the mouth. The eyes, well, you know how to place them. Slightly lateral and superior of center. 24 millimeters in diameter, approximately. You should have modeled it that way already, so it should be fine. And then, in terms of protruding, it should be a line going from the superior orbital rim to the inferior orbital rim. Those two tissue depth marker locations should pass between the cornea and the iris. So just in that area, if we have eyeball like this, this is the leading edge of the cornea. Here's the limbus here, where it changes angle, where the iris sits. So that tangent is going to pass somewhere like that. So that's how you know how far it should protrude. And we know the lateral palpebral ligament. So these are the ligaments that run through the tarsal plates or the eyelids and attach it to the orbit. So that's running from the inside edge of the orbit at the malar tubercle, and we'll look at that next week when I bring in the skull. And then the medial palpebral ligament runs to the anterior lacrimal crest. Anterior lacrimal crest. So if we look at that in the skull here, let me just turn this off for a second. So this is the anterior lacrimal crest here. Oops, don't do that. And the malar tubercle is going to be around here. And you've got your eye in the middle. And so you know it's going to run something like this. And usually the medial canthus is a little inferior to the lateral canthus. So you're going to get something like this, the canthus here. And this will give you an idea of the eye shape. So I think I'll go over the nose calculations next week, and we can do that together because there's a lot to do already. And I can give you the last half hour to actually work on setting up your skull so we're all ready to work on it together next week. Okay? Any questions about anything?